Asian double eyelid surgery gave me deformed eye shape. Is this normal due to swelling, or is it something worse? I had my surgery about 3 weeks ago and noticed that one of my eyes is shaped very weirdly post op. The inner upper corner is cut into the almond shape and looks so strange. It's more obvious in my right eye, left in the picture. Is this normal and due to swelling, or is it something worse? I know it's only been 3 weeks, but the rest of my eyelids seem to de-swell a lot already. I've browsed a lot of sites, but I never came across anything like this.
Thank you for your question. You submitted a photo of your right and left eye, and you're stating that it is about 3 weeks after surgery, and you're concerned about the appearance of the eyelids, and you're asking about swelling and relative swelling in the inner corner versus the rest of the eyelid. So I think that it is clear by looking at your photos that the answer is yes, there is swelling. And unfortunately, that does have a tremendous impact on the appearance of the eyelid crease. You see, Asian eyelid surgery requires a connection between the skin and the levator muscle. The levator muscle is the muscle that lifts the eyelid, like the word elevator. What that in effect does is it creates a very tight little compartment where fluid has a tendency to linger. Now this applies to both the incisional and non-incisional techniques of Asian eyelid surgery. So, although you may see examples of people who look good in 1 week, 3 weeks, a month, eyelid surgery swelling can last up to a year. And although it's more of a rare thing that it lasts that long, and it's more typical that usually by 3 to 6 months, enough swelling has resolved that you can have a good sense of what your final appearance will be. In our practice, we follow our patients very closely. We see them at 1 week, 3 to 4 weeks later, and then 3 months, 6 months, and the door is always open. And I have certainly observed how some people can have swelling that lingers. And factors such as allergies or sinus problems can certainly have an impact on that. I am pretty certain that your doctor would have discussed this with you prior to surgery. This is part of a standard discussion about eyelid surgery, whether it's an Asian eyelid surgery or a non-Asian eyelid procedure. But the answer to your question is this is swelling. You're just simply going to have to wait. It is unfortunately the reality that you cannot go and try to operate on something swollen unless there's a very strong indication. You usually have to wait so that you can actually manipulate the tissue as is necessary. In our practice, we actually will have patients open and close their eyes even when we're doing just Asian eyelid surgery, just to confirm that the crease looks the way we want it to. And so I think that communicating with your doctor is critically important. No one knows your anatomy and what was experienced during surgery better than your surgeon, and I think that waiting it out will probably work out in your favor. So I hope that was helpful. I wish you the best of luck, and thank you for your question.